Well, for those who are eligible, Medicare open enrollment started on October 15th and goes through December 7th. And I'm sure there are questions that you may have if you are eligible for it for the first time. Well, we've got with us from the wonderful capital of Mississippi, Insurance Commissioner Cheney. How are you, sir?
I'm doing very well, Jim. Good morning to all the people on the Gulf Coast, and I hope you're having a great day.
Well, it's a beautiful day. I know a lot of people are still, cleaning up and everything. Talk about open enrollment for Medicare Advantage and Medicare prescription drug coverage, because these new benefits will take effect January the 1st, but you have to get it done before December 7th.
That's correct, Jim. And the issue here is that during open enrollment from during November through December the 7th, you can change to new plans if you want to change. If you want to go to a Medicare Advantage plan, which includes dental and vision, now's the time to do it. If you go to an Advantage plan, one thing we tell you is this: be certain that the doctors or providers that you're seeing now are also in the program or in the network for that Medicare Advantage plan that you buy. That's very important. I want to give a number out to you, and it will be on your screen. If you have any doubts, we have something called the Senior Health Insurance Program in the state, where you can call this number toll free, and we will give you advice and help you walk through if you want to change any of your plans. We will help walk through the way to change those plans. And that number is 1-844-822-4622. Again, that's 1-844-822-4622. That's the Senior Health Insurance Program in the state of Mississippi, better known as SHIELD.
Now, Medicare is not a part of the federal health insurance marketplace, right?
Medicare is not part of the federal insurance marketplace. And if you have Medicare, you are not allowed to participate in the federal marketplace, also known as the ACA or the federal marketplace. And if you happen to buy on the federal marketplace, after you're 65 and eligible for Medicare, you lose any potential subsidy you would get, and you lose your Medicare benefits. So do not buy on the ACA if you're over 65. That's just something we tell you not to do.
What are some of the tips that you have for individuals who, regarding someone contacting you on a type of Medicare coverage?
Well, if someone contacts you about Medicare coverage, ask them, are they licensed by the state of Mississippi? Because you have to be licensed by the state of Mississippi. The other things that you would need to know is they cannot make those people, I say they, the people that are contacting you about buying a new policy, cannot do that through an unsolicited contact. You have to make that contact yourself. In other words, they can't knock on your door and try to sell you a policy. They can't make what we call a cold call or approach you in the parking lot at your local grocery store or at a restaurant. So they have to have an appointment, and they need to talk to you before they come to your home or before you can ask them. You're the one who has to initiate the contact.
So they cannot sell you a plan in certain healthcare settings, such as a doctor's office or a pharmacy. They cannot approach you in one of those settings.
Correct. That's correct, Jim. They can't come into the pharmacy while you're there and say, look, you need a Medicare Advantage plan, let me sell you one. They can't do it while you're at a doctor's visit in a hospital. And that's very important to understand. We've had some unscrupulous people try to change you on Medicare to different type plans in what we call assisted living homes. And we've had some issues there, but we've about got a handle on all of that. We did have an issue on the Gulf Coast last week, and we solved that rather rapidly, where someone had kind of baited and switched, saying we'll give you free medical advice, but you got to fill this form out. And the form included changing over to a new product. So we prohibit that.
And they can't offer you free meals at promotional or any kind of sales events or educational events.
As much as we may like pizza or try to go to Salute on the coast, they can't offer you a free meal there to switch over. Although that is tempting, I will admit.
As I was looking at some of the notes that I got here, that to protect Mississippians from becoming victims of Medicare fraud, y'all remind consumers of these safety tips. Beware of door-to-door salesmen. Remember, agents cannot solicit business at your home without an appointment, and do not allow uninvited agents into your home.
Very wise words, and we put that out to consumers every year. And you can visit our website, www.mid.ms.gov, and look for the Medicare area over on the right-hand side and click on it. It'll give you some ideas. If you don't have a computer, again, we encourage you to call 1-844-822-4622 for help on your SHIP or Senior Health Insurance Program, particularly Medicare.
And another very important thing is, do not give out any kind of personal information to these people, because that could really cause a problem for you down the line.
It will. Never give out your Social Security number. That's what people fish for, and that's what they use to pull scams off. So never give out your Social Security number or your date of birth unless you know who you're talking to and you're in a secure location to give that information out.
And of course, you want to verify the plan you have chosen is an approved Medicare plan. And all of the approved plans are available at www.medicare.gov if you want more information on that.
That's correct. And a lot of people, you can go to the Social Security Administration's website. If you need some help on the Social Security Administration website, you will find the information that you may need to talk about your beneficiaries, the federal assistance program. It's in addition to what you may find on the Medicare.gov program. So to go there, you can also call 1-800-SSA-1213. You can go to their website, and you can also visit www.medicare.gov for more information.
And also you get information about your Medicare prescription drug options as well on that Medicare.gov website.
Yeah, and with open enrollment, you may have had a change in your health conditions during this past year where you're taking a different type of drug from anything you've ever taken before. And now is the time to try to address that issue so that you will be covered under Part D of the drug plan. So that's why you might want to look at going to a Medicare Advantage plan. Be certain that if you're on the Gulf Coast, that your doctors or your healthcare providers are in that network for that Medicare Advantage plan. Most of them are on the Gulf Coast. We've had very few problems on the coast with the hospitals there. So just to be safe, though, you should try and to go to those websites and be certain that they will take your doctors. Now, another website you can visit is www.shiptacenter. It's shiptacenter.com or .org, pardon me. And you can find a lot of information about Medicare Advantage plans.
All right. Commissioner Cheney, thank you so much for joining us with all this great information today. Remind everybody again, you have until December 7th to do your open enrollment. So make sure you do that. Thank you very much.
Thank you so much, Jim.